Alright, welcome back to the Meds to Know series. We're going to be talking about a drug named ATROPINE, which is a competitive muscarinic antagonist. If you remember back to your med school days, there are two types of acetylcholine receptors, muscarinic and nicotinic, and atropine is a competitive antagonist at the muscarinic receptors. We use atropine most often when a patient is experiencing drug-induced bradycardia. It's also effective when a patient is just experiencing vaguely induced bradycardia. The other indication for atropine is acetylcholinesterase inhibitor poisoning. It's a classic boards question. One type of acetylcholinesterase inhibitor is an organophosphate, which is often in pesticides. That's usually how it shows up in the boards. And again, that works because we're talking about a competitive antagonist at an acetylcholine receptor. Next, let's talk about dosing. We're going to start out with the dosing for drug-induced bradycardia. The dosing for adults is going to be a little different than for kids, as is usually the case. Adults get 1 milligram IV every 3 to 5 minutes, up to 3 milligrams. So you can repeat it 3 times. For peds, the kiddos, they'll be getting 0.02 milligrams per kilogram IV with a minimum dose of 0.01 milligrams. Again, this is for bradycardia, not necessarily for organophosphate poisoning, which is what we're going to be talking about next, which, again, is a type of acetylcholinesterase inhibitor. And this is good to know if you're a provider that works in EMS or is in the military, because organophosphate poisoning can be seen in terrorist attacks. So for adults, in organophosphate poisoning, adults will be given 1.2 milligrams with a doubling of that dose every 2 to 3 minutes. And peds will be getting 0.05 milligrams per kilogram, which is 50 micrograms per kilogram. It's worth noting that atropine only works at the muscarinic receptors, and so we would have to use pralidoxime, another medication, to treat nicotinic effects from poisoning. Lastly, let's talk about the side effects patients can experience with atropine. Many of you will know the mnemonic: mad as a hatter, dry as a bone, red as a beet, hot as a hare, blind as a bat, and full as a flask. Mad as a hatter refers to the CNS toxicity, which can cause confusion, anxiety, hallucinations, psychosis, seizures, coma. Dry as a bone refers to patients experiencing dry skin because the sweat glands are innervated by muscarinic receptors. Red as a beet refers to the flushed skin patients will experience. Hot as a hare refers to hyperthermia. Blind as a bat refers to the mydriasis and ineffective accommodation that patients experience, leading to blurry vision. And full as a flask refers to urinary retention.